Hi, everybody. We're just letting people in. We're gonna give it a couple more minutes.
Okay, I think we can start now. We wanted to give a couple extra minutes for everybody to log into this webinar. Well, thank you very much for everybody for joining. Just as an opening, this is going to be going over the support tool. Um, this is a new initiative that we're starting up, so we know it's there are a lot of moving parts with this, so thank you very much for bearing with us. Hopefully this webinar is going to go over a lot of the questions that you may have. We're going to try to do a couple of things during this. Okay, we can go to the next slide. We wanted to talk just complete overview over the SPARS support tool. It'll go over all the trainings, all the general information. And then on top of that, because we are all CCBHC oriented, we're going to go over very specific considerations for you as grantees when thinking about how you're implementing the support tool within the context of the CCBHC grants. We know that there were a lot of different moving parts during the rollout of the support tool. The big one being, unfortunately, you weren't able to necessarily ask the questions and we weren't able to respond due to the government shutdown. We are going to give you a lot of ample opportunity to respond and ask questions during this. So the first thing you'll notice, this is not in Zoom, this is on Teams. There is a slight, I'm going to quickly explain how to do the question and answers for this. If you look at the top bar of your Teams chat, you should see chat, and next to it should be open Q&A. If you go to that tab, it will open a sidebar on the right side of your screen. In that, you can click Create Post. Create a post, ask your questions, okay? Throughout this entire time, just whenever you have a question, hopefully we answer it during the office hours in this webinar. If we're not, just create a post whenever you have it. We will respond to it. If we don't respond to it right away, don't worry, we'll try to get to it. We might not respond in the chat. We will be archiving it. We'll try to respond it at the very end of this webinar. We're going to have a whole Q&A section, so maybe we'll answer it live there. And if we still do not get to it, we will be responding to all these questions. We're going to compile a whole list, and we will be pushing out an FAQ, okay? Once you create your post and your question, when we respond to it, you should see there should be a drop-down filter right above it. Under that, you will see all conversations. You should also see your questions. You can jump to that, or archived. Click your question, so you'll jump straight to it. If you're curious about other questions that are being responded to, click archived. It will show all the archived questions that we are going through and answering, okay? Hopefully that makes sense. If it doesn't, just create a post as you need. We'll respond to it, okay? Okay, next slide, please. Okay, now going back to this support tool. Why did we move towards the support tool? You'll notice this is a complete shift from the NOMS. This is one of our key strategies, that data collection strategies that we're doing. If you recall, this falls under our GIPR reporting requirement. For SAMHSA, we are required to collect data and push it up to the legislature as part of our obligations. Before this was the NOMS, we're switching over to the support tool. This support tool is going to be a more unified tool across our different centers. So you might see, if you have different grants, or you have other colleagues at other organizations that have multiple grants, we all should be operating off of the same unified tool now. Hopefully that makes things a lot easier. In addition, the main point of this is to reduce burden for everybody. Hopefully this reduces burden on your side and the client and your frontline staff, or whoever is collecting the data. One of the big shifts for this is we have two different versions of this, which we will discuss in here, the support A and the support C. A lot of the burden we're trying to shift from your consumer, who would have to provide information in real time, to the backside. And hopefully that reduces burden to everybody. With that said, I'm going to invite Catherine Beislein to provide the rest of the information on the support. And as I mentioned, if you have questions, please post them throughout this. We'll be answering it live. And if we don't get to them, we'll respond to them at the very end of this. So with that, Kate, go ahead.
Great. Thanks everyone for joining today. I'm going to be going through a few more slides. Some of these might be refreshers if you have attended or downloaded some of the resources that are available on SPARS, but because we had the government shut down, we thought it would be a good place for us to go ahead and start with refreshers and then go into some of the frequently asked questions. Across the board, the support is standing for the SAMHSA Unified Performance Reporting Tool. It does cover the client level data that is coming from the support C, which is actually collected directly from our caregivers and clients. The client level data in support A, the administrative report, which you may collect in different ways from the clients or caregivers, but in the end, it's your responsibility to pull it all together and get it into that system. It also includes project measures, and while as a CCBHC, you're not currently assigned any IPPs, and so therefore you may be like, why are you even telling me about support P? Maybe you have another grant, or maybe in the future, new NOFOs for CCBHC might be required to collect the support P. That's still coming. This is project level indicators. And then the last part of our sort of reporting framework that we have for all of our grantees is our PPRs. Of course, for CCBHCs, you also have quality measures coming in there, but there's a lot of reporting to talk about here. So jumping right in on our focus for today, which is the support A and C. So the client level support includes two major components. That's our support administrative record, the support A, or the support C, client caregiver. As I mentioned, coming soon to replace the IPPs will be the support project, also called support P. These separate components for the client or caregiver, if you had printed it out when it first sort of came out, you would have had a lot of different documents sitting there in front of you. So there's the ones for the client or caregivers, and there's the administrative report. The support A administrative report really replaces the components of the NOMS that we used to have you do even if you hadn't interviewed the client. So we used to call these like the administrative record, and we'd say, hey, even if the client declined the interview, you still have to go in there and fill in certain components. We've separated these out so that when a client is looking at it, they don't have to go, oh, skip this, skip this, skip this, skip this. It's easier if they're in the two separate places. So the big reminder there is Support A is completed regardless of whether Support C is completed. Support A is always a requirement for every assessment for every age group of the client. And as you go through the Support A, if you've already looked at it or you're starting to implement it, you'll notice that in some places you may not yet be collecting the data, or you may not yet be collecting the data in the way that we ask it in Support A. So you might have to update your data collection so that you can have that information in your systems that you can pull out and then get into SPARS for us. The Support A and C, as they work together, have multiple collection points. These are pretty similar to what we've had before under the NOMS, but there are some changes. So the Support A is collected. These are all the assessments: the baseline, the reassessment, the annual, and the closeout. And the Support A, again, it's required even if the Support C is not done or is not required. The Support A with the reassessment, that is a 6-month reassessment for CCBHCs. That was unchanged coming over from the NOMS. The annual assessment is a new requirement. This is for clients at 24 months, 12 months, 24 months, 36 months, 48 months, if they are still actively receiving care. And then the closeout is really similar to the discharge record that we used to have. For the Support C, we ask that it be offered at every assessment point where it's required, but it doesn't have to be completed because this is not a requirement of you as the grantee. This is of the client themselves or a caregiver. And so it is voluntary for the client or caregiver to decide whether or not they're going to fill it in. And those are at the baseline, the reassessment, and for adults only, the annual assessment, that one at 12, 24, 36, and 48 months. And then also the note down here that even if the baseline was refused, then please still offer the reassessment, or if the reassessment was refused, still offer the annual assessment if it's applicable for that client. For all of these, as I didn't actually have it written on the slide, but just to say out loud, and then we'll start emphasizing it more on some of the future slides. This is for clients who you have sampled for data collection. Clients that you have sampled for data collection. So similar to the NOMS, although all the documentation will say all clients, it is for CCBHC, it is all clients that you have sampled for data collection. The data collection requirements, showing these again, is that we're looking for all assessments once they've been collected, whether it was collecting it for the Support A or collecting it for the Support C. We're asking that you get that data into SPARS within 30 days. You can either enter it manually. Some of you have already been in. We can see have entered some records already, or you can batch upload it. But we do ask that you not sit on those forms for months and months and months. Get them in there within 30 days. The way that it's currently set up is that for the baseline assessment, you must first have a Support A before you can enter in a Support C. And you're going to see that for each of the assessments, that the A record should be in SPARS before the C. You can collect the C before the A, but you have to enter it into SPARS in that order. Because they use the same client IDs, they're all linked. So the way, if you've gone in and tried to manually enter these in SPARS, the first record is set up with that A. The reassessments and the annual assessments are not required if a closeout assessment has been completed. So just like we've had under the NOMS, if the client is discharged, if they've finished up their services for this episode of care, you don't have to keep tracking them. The reassessments and the annual assessments are only due for active clients. And if you have closed a client and then months later, they come back, they start a new episode of care, then you start the cycle again with a new baseline assessment and then a new 6-month reassessment and annual assessments as needed. The Support C client or caregiver form, if you downloaded one of the versions that had them all put together instead of sort of separated out, you might have seen the initial page where you had links to each of the different forms. These forms were really designed so that you could hand them right out. So we have many grantees who are just going to print, hand out, and collect these in written format. If they did that, we wanted it to be set up that they didn't have to go in and kind of remove questions, or that the client would be looking at these and going, wait, am I supposed to answer this? So they're set up, and the reason that they've got so many different versions is to handle that skip logic. But if you program this in an online thing, you can program that skip logic yourself, and you can run essentially on one form and then just have the skip logic built into your online system. We have the different versions or the sets of questions depending on the age group. So we have adults, we have youth, we have child, and we have young child. And we have the different versions depending on whether it's a baseline or reassessment for all the different age groups, or whether it's an annual assessment for that adult. A few key changes that we want to emphasize here, different from the NOMS, is that we have clearly separated that admin record, which is completed by the grantee, by you, as opposed to those that you could print out, that you could hand out, that you could incorporate into an online survey to be completed by the client or caregiver. This way, we don't have that skip logic kind of right in front of you while you're looking at it. We removed the requirement for interviews. So the default method for surveying clients or caregivers is to be a self-completed assessment. Paper, tablet, computer, whatever works best within your own process. We'll talk a little bit more about this in the frequently asked questions that we've been receiving already. But the idea here is that the default method is not an interview. You could do it as an interview if that makes sense, given the capacity of the client, the capacity of that caregiver, the particular way that you implement a process within your system. But we wanted to make it that it wasn't a requirement for an interview. We've also shifted a lot of questions from the client caregiver survey to the admin record. And that's because we heard over and over again that a lot of the questions we were asking in our interviews are already asked as part of your intake or as part of your behavioral health history taking, so that they were already built into processes that you were doing internally, and you were then having to like re-ask the client, and that was an extra burden on the client and on you. Now, hopefully, if you collected it in one place or for a different SAMHSA program, you can take that same data that you've collected in different places and use it in that administrative record. We also did add those annual assessments for the active clients and the closeout assessment at the end of the grant for active clients. Those are two new requirements, and mostly what we're really trying to capture here is we want to show that those clients that are in care for more than the 6 months, that we're still tracking on, that we're actively providing them services. So we're really looking for that evidence for you to come in and say, yes, we saw that person 3 months ago, even though, yeah, we've seen them every year. We also saw them 3 months ago, and they continue to receive these services. That really helps us justify continued funding for the programs. So that's the main reason this extra reporting requirement was added in. So showing again, because this is such a big change, is this difference from the interview not required to the self-completed survey. And even within this, which if you were working on the NOMS, you know, we didn't even have the consent before. The consent is right there on the tool. What should be really asked in the consent, and the questions set up, print it out, or incorporate it in your system and use it right away. We did through testing, and we had some of you, thank you if you participated in the cognitive testing that was done on these tools or provided comments as we went through the public comment period. but we did look at, and in particular, in terms of the burden for the clients, this should be a massive reduction in the client burden. Yes, some of it may feel like more burden on the grantee, but it also hopefully is a burden that you can take on and more of an administrative factor instead of having to have that burden be FaceTime with the clients. Again, this kind of focus of, we moved some of the questions out of the admin or out of the interview and out of that support C facing to the client and into an admin record, because many of you have this information, or you're asking this information, or you've been considering asking this information as part of behavioral health history. For example, on the client admitted to the hospital, you might have been checking that anyway, right? Behavioral health history. Or you might have already from your records a referral that the reason that the client came in for a visit today is because they were recently admitted to the hospital, and this is their visit to the provider following that visit to the hospital or following that visit to the ER. So those kind of administrative records can be used to help us on the support A and provide that information. We've also changed many of our questions, the way we're asking them, particularly around the demographics or the social drivers of health. We've changed those to align to standards that have been applied, whether those are executive orders or HHS standards for interoperability. So our hope is also particularly on admin questions that you're seeing, that questions that we're asking, that HRSA might be asking, that CMS might be asking. We're hoping that we're coming to a more and more interoperable and ask once, report in as many places as it's required kind of framework. We did remove many of our noms. This doesn't mean that you shouldn't be asking questions about the social connectedness or functioning or psychological distress, but you're probably asking those already in your clinical practice through other verified and validated tools that we're measuring those things as well. We have also added client-reported core outcomes of recovery. This is a new measures that we have. So we are looking for adults right now for those outcome measures. We do expect that over time, new measures will be introduced for children, but since SCORE hasn't yet been tested among children and some of the measures are more about recovery rather than just resilience and growth, that's why that section with the core outcomes of recovery is only applicable for adults currently. We've reincorporated questions to cover substance use and substance use treatment. And I think for many CCBHCs in particular, and some of our other programs within CMHS, this felt like a gap when we changed the NOMS in 2022, that we dropped our questions on substance use. Those are now back in. There's questions about the screening or services that you provided. And it's an opportunity for you to track those services that you were providing anyway, so that we can have that. The same thing, because this is a unified tool across all the CMHS and our CSAT, our Center for Substance Abuse Treatment programs, that we'll have substance abuse treatment programs finally able to acknowledge, to document, and to show that they were doing screening for mental health services and providing some treatment for co-occurring disorders as well. And if you've looked at our service arrays, that before under NOMS, we had just like mental health services or core services, and then we had supportive services. Now you'll see sections for mental health services, for substance abuse services, for crisis, for integrated health, all broken out. And while at first it might take a little bit before you build up the systems and the processes so that you're tracking those, in the end, this will show a fuller picture of all the work that you're really doing to treat that whole person when they come in for your clinical care. A couple other key changes, this was a big request as well for us, is that we've expanded the window for data collection and reporting from within 7 days to within 30 days. And that window is both a plus and a minus. So it's really a 60-day window. Before you saw that on the reassessments with the reassessment is due on this day, 30 days before, 30 days after you can collect. But we put that in on the baseline and on the annual assessments and on the closeout. There's a 30-day around everything. So that should allow you to incorporate it better into your own processes, not make this a separate activity that you're having to do, that you can build it right into the process that you already have. We're also hoping that this allows you, again, if you have a grant from any other part of SAMHSA that's using the support tool, that you can collect the data once and report it under multiple grants, because that window is now larger, and that might have been blocking you from being able to share that data before. And a reminder, you should be using your approved sampling plan while implementing the support AC. That part did not change at all. If you were approved at a 2% or a 5%, or whatever rate you were approved at, and in terms of how you were choosing that sample, still applies over here, except instead of sampling them into NOMS, you're sampling them into support AC. Another question that we have already received a lot, and we have recently have gotten guidance on this. It will be updated online. You'll be able to pull this out in the frequently asked questions posted on SPARS, but late breaking news is on incentives. You may continue to offer incentives. This will be for the 6-month reassessment and the annual assessments for the support C. So the support C, that's the part the client or the caregiver fills in. And just like we had before, we don't want to have a potential conflict where it seems like we're incentivizing people to start treatment. So we didn't want it on the baselines, but we do allow it on the reassessments and the annual. Same amounts as you were using before. Same policy guidance as you had before. It just now carries over from NOMS over to support C. The NOMS had only included a 6-month reassessment. So if you want to be providing incentives for that annual assessment, you may need to consider that as in your budgets as you're looking at that. So take that into account as you budget out and plan for whether you can do incentives and how much you can do. However, on the flip side of that, remember that if a client has a baseline NOMS, in other words, if that client is in an episode of care where they started in NOMS, they started before October 1st, 2025, and they're now in support, you have to do support A, but the client does not get asked about support C. The support C requirement is waived during the transition period for any client who has a baseline in NOMS. So therefore, you wouldn't need any incentives because there's no support C. So look at a little bit at your budget and kind of figure out whether or not you need to have those conversations about your incentives, but they are allowed. Smaller print. Going to try to go through these though, because I think it's going to get out and maybe we'll limit how much we have to address in the live Q&A. So do we need to create a support AC record for your client? No. If they were already a NOMS client, SPARS has moved them over. And I can tell you right now, if you don't see a client that was in NOMS, if you don't see them in support AC, then please write the SPARS help desk, because then there's an issue. You should be seeing any client that you created in NOMS over in support AC. If this is the client, it's their first time that they're coming in and this is the first time you're entering them in SPARS, then yes, create your support A record first. As I just mentioned, do we have to use the support C for a client who was interviewed under NOMS? They had a baseline, maybe they even had a reassessment. Nope. For them, the support C requirement is waived. Only a support A as they finish out the duration of their care. What if, particularly during the shutdown, and maybe you didn't get your questions answered, what if you've got a backlog of clients or you stopped using the NOMS as soon as you got the notification that you could stop doing the NOMS? So you have clients who maybe started care or they were due for a reassessment or something during September and that transition. It's okay. Do a support A for them as soon as you're able to collect the information on the support A. So we always expected that there could be some delays in entering the data on those. Because we've got a 60-day window, it's no problem. You could say that they enrolled for care on September 15th and you're getting in the support A data even now, because this is still the transition period and we had shut down and all sorts of other things delayed. So no problems, but go ahead and get those in as soon as you can. We don't routinely screen for some of the behavioral health screenings that are listed under the support A, or maybe you don't have that history. You're not including that in your history taking. So look at those. For the most part, those were added in because these are good practices, but maybe the timing is off. Maybe in the specific timing was set that it should be only at, it should only be done 6 months. It shouldn't be done every year. That's okay. We're not trying to change the timing. We're not trying to tell you to do that assessment just because of support A. You can look on the form, and as you're filling that in, and if you didn't do an assessment, you just say, we didn't screen for that. Wasn't indicated, didn't need it, had more recently done it, but not within your period. You just report that it wasn't done. So we're not trying to change your practice on the basis of having the question there. It is okay to say that you didn't ask the question. The clients receiving services under multiple SAMHSA grants, do we have to do separate assessments? No. This is hopefully a relief to a lot of people. We have one tool, CMHS and CSAT. If you have a services grant under CMHS or CSAT, and it moved over to support AC, you can now use that. You collect the data in the one place. As long as you're within that 60-day window, you can report that data under 3, 4, 5, whatever you've got, as long as it was appropriate. So I'm not saying that you should double charge for anything under a different grant, but if you have a client who is receiving multiple services under different grant programs, absolutely, you can report the data on that client and as many times as you need to report it. We haven't yet changed our intake forms to collect race and ethnicity in the new categories. What should you report? So this one is a little bit tricky. If you've looked at the support AC, it does have a section, the support A, it does have a section way at the end of it, which is race and demographics. That is our way of capturing race and demographics for clients who maybe didn't capture it on the support C. Maybe that's because the support C was newly rolled out. They already had a NOMS baseline, so we're not using the support C for them. But we're looking for that demographic information so that we can do the reporting that we need to do about our client population. But really, the demographics should only be completed in the support A if the client declined to complete the support C at baseline. So if you have data to report on that client and they decline to report on the support C at baseline, the whole support C, they didn't specifically go, no, I'm skipping the race and ethnicity questions here, but they said, all of the support C I'm not doing, and you had the data, you could report it. But most of us haven't yet changed over our demographic categories to this new reporting. We've got a couple years to still roll out the systems. Maybe you're waiting for CMS to tell you to change your systems, or HRSA or someone else to change your systems. If you don't have it under the new categories, just say it wasn't captured using those OMB categories. Also, a question had come up, and I think it's really important to talk about here as well. Don't report information in support A if the client didn't really give you permission to be sharing that information. So along your participant protection, along with your confidentiality, you should be having a consent form that makes it clear that you're sharing data with SAMHSA and what kind of data that you're sharing, and that they should have a right to refuse the data that would be more personal. And so if they've refused that data under your consent forms that you have, then you would leave these blank, or you would say that you didn't capture it in a way that you are able to share. I don't remember the specific option, but it is absolutely allowed for you to have a consent process for the client to decline to report some of this data to us. If an individual requests to discharge from services before their 6-month or annual reassessment dates, do we complete a discharge support A, or do you complete the reassessment support A and support C? as similar to the NOMS, we only do reassessments if the client is active in care. As soon as they have a discharge, that episode of care is closed out, it's finished. No reassessments are due if they hadn't been due yet, and no annual assessments are due until they have a new baseline and then they're active in care. So we only do assessments when somebody is active in care. Does the client-facing portion of the support tool need to be completed in person, or can it be conducted over the phone? Get this question a lot. So in many times we thought maybe people would hand it out by paper or incorporate it in the electronics, but we are getting lots who are saying, no, we do our intake over the phone. That is fine, so long as you have those policies in place, to ensure that you're talking to the right person, that you're not sharing, that you're protecting the client privacy and you're getting consent appropriately. You can do it over the phone. You can also share a QR code or a link to complete it via email to the clients. We ask that you don't email the form back and forth over just email because it's not protected. But if you have a protected client messaging system, or you're just sharing the links, and then all the protected information is once they go to the link and enter in, like whatever kind of passcode they need to be able to get to that is appropriate and allowed. We've also get this question a lot where if the youth who's 12 to 17 completes the support C, does the parent caregiver also need to complete the support C for the children, which is the 5 to 17-year-old one? Because we do have these two templates that have this overlapping age group. And that's because, similar to how we did for NOMS, it's up to your internal processes, it's up to consent and assent requirements within your practice or within your state. It's up to the capacity of the individual, the preferences of you as a provider, the preferences of the actual clinical capacity. There's a lot of things that can go into that. We leave that decision up. It can be done on an individual basis, whether or not the caregiver completes it or the youth completes it. We do, though, only want one response. We don't want both a caregiver and a youth. And will both 3-month and 6-month reassessments be required? There are no 3-month reassessments required for CCBHC. It's only a 6-month, and only if it's an active client. More questions? Annual version only at the 1-year mark, or every year consecutive? Annual is every year. If they're active at month 48, then they need a reassessment at month 48. So the grant has to be active and the client has to be active. We also wanted to point out here, because this is also a little bit confusing. So the support A is required at annual for an active client, for a 5-year-old, for a 20-year-old, for a 15-year-old. It doesn't matter the age of the client. The support A is done because that's where we're capturing that the client's still in service and what services they received. But the support C, the main thing on the support C is these follow-on questions from that SCORE, the SAMHSA core outcomes of recovery. Sorry, trying to remember what SCORE stood for all of a sudden. So those core outcomes of recovery are currently only tested among adults. So the support C is only for adults at annual assessment, but the support A is for all age groups. If the client-facing portion is not completed within the window, should the record management of support C still be entered into SPARS? Yes, please. That would really help us. So just like we used to have within the interview form, where we said, which assessment was this, which client was this, and did the client consent as our first questions, that's the record management portion of the support C. And it would be so helpful for us if you completed that. Even if they decline, that would be the only thing that you complete. As soon as you hit, yep, we offered, they declined, moved on, or maybe it's that you didn't have a chance to offer it, especially right now in the transition period. They started, you didn't have your processes up and running. So just fill in and say, yep, you didn't have consent, so there's no patient response coming in here. That helps us to all know it wasn't, that data's not coming in later. It's just cleared out, and we have some idea how many clients are not being reached or providing consent. How will reassessment interview rates be calculated with the transition and implementation? Well, first, there's no reassessment interviews. So there's no interview rates. That's the really short answer. We're not tracking interview rates anymore, but we will be looking at completion rates. This is a survey. We do want to have an understanding, particularly around the demographics, the social drivers of health, and these outcomes of recovery. We do want to be tracking those over time. And so we will be measuring those completion rates, but we haven't yet set those targets or those guidance. We'll be sending those out as we get some experience with the tool and we're through the transition period. If the data collection window for support C has closed, so this is the client caregiver, do I need to offer it to the support C to the client? Nope. Move on. These things, right? When we're surveying the client, we're not asking them for recall bias, 9 months after they've been in treatment. How did you feel at baseline? And try to get information out of there. It does have a window. That window helps us to really know, yep, this is what the client was thinking at baseline, how they're feeling at baseline, what their situation is. So the data is just not as useful once we're outside of that window period. So don't bother collecting it. Just get in that record management, say you didn't get it collected, and move on. However, if the data window for support A has closed, do I still need to report support A? Yes, as soon as possible. So particularly during this transition period, we understand that people might have enrolled, they might have closed out, they might have hit their reassessment period or the annual assessment period. As soon as you can, get that data collected, complete as much as you're able to complete that's relevant, get that record just entered. So that helps us, and use the data as close to the window as you can, and move on at that point. So different requirements based upon whether we're asking the client or we're asking you as a grantee. And also really there's different expectations once we get past the transition period. So we understand fully that there'll be a lot of misses and outside the windows as we were in this transition period. But we're hoping once we start to get into January that we're fully implementing this and we're able to hit those data collection windows on time. Will there be reports? Will there be batch upload functionality? Will there be data download? Yes, yes, yes. All of these are coming. I think we're going to first see the batch upload is first to get that will be available if within the next couple of weeks, if not this week. And then download functionality after that, and then reports after that. So we're eagerly awaiting it, just like you are. We know once these things are up and running that, of course, they'll be, having to ping the SPARS help desk, having to work with your GPO, ask more questions as we make sure everything's functioning okay. But all of those things are coming. So those were all the slides we wanted to go through. I think we've got more time for additional Q&A, and I hand back over to Hillel.
Thank you very much. So we've been trying to respond to some of your questions in the chat. There are a couple of questions that we just want to respond to here live. A lot of the questions were pertaining around when to conduct some of these interviews. So some of those were answered during the live session. A lot of those are going to be like, what happens if they were enrolled in that under a NOMS and now are being in, the reassessment is under the support, or their annual is under the support. So as Kate mentioned, you just have to do the administrative version of them because they were grandfathered in under the NOMS. Now, Kate, if you wouldn't mind responding to some of these. The first question was what happens if the patient transitioned from a child to an adult during this time period?
So during an episode of care, so there was a baseline. The baseline, at the time the baseline was done, they were a child. Stick with that throughout. So if they were 17, even if they were 17 and 11 months, and you completed for them the support youth at that point, stay with the support youth, even if they stay in care for 48 months. Those kind of age groups don't matter at all on the support A So there's not the different versions that you have to worry about on the support A. So we'll see under the support A that they've grown up and that they're receiving probably different services as they transition into adulthood. But for the baseline and reassessment, if they completed the young child, the youth, stay in the same form for those next assessments.
Thank you. The second question is about notification reports. So previously under the NOMS, grantees were able to download reassessment and annual reports so they would know when things were coming up. I know you mentioned that the downloading data is going to be affected and not provided right now. What about these notification reports?
Yeah, so SPARS is working on building a dashboard. So as you come in as a grantee, you would be able to see and pull right out on the dashboard which assessments are due, outstanding, or coming up soon. So that is coming in. It's definitely something that they're working very strongly on. I'm not quite sure when that sort of dashboard functionality will be available in SPARS. The first priorities are the batch upload, and then the next priority is just data download so that we can at least get data back out and do the double check that what has been entered is correct. And then it'll probably be dashboard functionality before more like just kind of standard reporting. They're actually focusing more on this dashboard, your to-do list, things like pinging you reminders of next assessments due is the higher priority than getting you out a report of this is how many clients were served over the last year in total.
So, but I think they're curious about when they would be due, so they can make sure they're not missing those windows. So at least in this interim period before that functionality is there, it would be correct to surmise that they should be doing that on their back end.
Yes. So regardless of whether we have a notification or report coming in for you, the reassessments are due at that 180 days, although we call it the 6 month, it is the 180 days. That's the due point. And then the data collection window is the 30 days before and the 30 days after. All of that's unchanged from NOMS. So hopefully you already have that kind of pinging within your system. And then the 12-month anniversary is the 365 days. So it's 365 days every 365 days. That's from your baseline support A record, because on your baseline support A record is setting the date for when everything starts. So add 365 days to that. I will also say from that, if you had a support A that was due, let's say it would have been due September 29th, 2025, because the client had already been in care and they hit their annual anniversary on September 29th, 2025, you don't have to do an annual assessment for something that happened before we changed tools. So then the first annual assessment for that client would only be September 29th, 2026. So if the due date was before we changed tools, you don't have to do the report at all.
Okay, thank you very much. So some of these questions like were just responded to, so I'm trying to skip around to some of the ones that haven't been responded to. So we do have somebody that's there are some issues uploading some of the information as far as the support A without the matching support C in SPARS. Have you heard about any issues about that?
So I think the main thing to know is we're not tracking on major issues with implementation. The only way we can track on major issues with implementation is if help desk tickets are created. And so if you're facing anything, you're not seeing clients that were created under NOMS, you're not seeing them sitting over under support AC for you to enter record. You maybe had a baseline and a reassessment under NOMS and it's pinging you to do a reassessment under support AC. Like if you're seeing anything that doesn't match what you think, please, please, please write a help desk ticket. It is always helpful if you include screen captures or more like, kind of say, this is what I expected based on the guidance. This is what I'm actually seeing. And then also it's helpful if you copy your GPO, because if you copy your GPO even on a help desk ticket, it helps us to know, wait a minute, things are hitting the help desk. They're not getting resolved. Because as of right now, I have not heard from the contractor that we're running on problems with this.
Okay, so if you're having any issues at all with any of these uploads, if it's giving you information that you provided the A and you submit a C or didn't provide all of the C because the client refused and there are any issues with those, please just send support an email through SPARS. That includes, and I know there's some other questions about any other information with that, so go through SPARS. So if you're seeing notification reports that are incorrect and not matching, just go over off of what you have, email them, and we'll go from there. Also, please reach out to your GPOs if you're of any confusion on this. There would also be one of your support pillars through us, and we can help with that. There is a specific question about support A, about one of the specific questions. Do you want to answer that here, or should?
I might be able to.
Okay. This question is an E2 of the support A. One of the questions is medications outside of grant funding. So their question is, if the provider does not expense SUD medications to the grant, would they be completing this section?
So I don't believe that any of our grants are actually funding SUD medications, but we're still interested in tracking that we have clients who are receiving those SUD medications as part of the services. So we obviously, particularly for CCBHC, we're offering SUD treatment. We're doing co-occurring disorder, and so that question was really about the fact that are we giving access to it? It wasn't about whether or not the medication was paid for under the grant. In fact, most of support A isn't necessarily saying, were we the payer of this? It's really kind of tracking that as a result of the grant, these are the services that the client received. And I think that's consistent with how we've been working with CCBHCs. There is the new question that was added in the support A, which does also ask, who is the primary payer? Because in many cases, it's not the grant funds. So that's why we've got a question asking, is this person receiving Medicaid? Do they have private insurance? And we would most likely assume that the primary payer was covering those medications. So yes, is the long answer to that question.
Then I have a question about how the questions are being populated right now. Some of the grantees are seeing the entire support A, right, regardless of the program, and they're seeing those. They are curious if would that be changing? Or are they gonna, when they look at the tool, they'll see all the questions regardless of the program.
Yeah, I think the intent was there's a handful of questions. There's very few questions, but there are a handful of questions that really were only supposed to be like for our minority AIDS program. We have a couple questions there for clinical high risk, and we have a couple questions that were only for if you're a grantee from CSAT. And we do want those to be functioning under skip logic. That's a future enhancement, is my understanding with SPARS, that they'll built in, like that they'll be able to see on the back end that question doesn't apply for you. But in the meantime, you can just put not applicable there.
Okay, and then we have a question specific. This is going to be specific about the CCBHC. When you were talking about rates, so the question was, will there be specific rates that the GPOs will be looking forward in terms of the records?
Yeah, there definitely will. So, I mean, first of all, on the support A, we're really looking for that to be 100% completion, because that's a responsibility of the of the grantee. And in order for you to get credit to say that you had a client receiving services, we'd need that basic support a baseline. And then for the reassessment or for any annual assessments or the closeout showing what services they received since their last visit. That's kind of the minimum that's expected. So we're looking for a record. We're looking for some basic fields to be completed to, kind of say that the grant implemented the services that were required as a requirement of the funding. There's a lot of the other things in there that you could say, don't have this information, haven't collected it yet, and that's okay. We will also be looking to set targets on that support seat going forward to make sure that we are, really truly offering it. We're going to base it a bit more on once we get some feedback on the implementation and we get past the transition period. And we'll work with you on implementing to those new targets, including, providing assistance as we develop those to say, well, how can we work with you to improve participation? Are you offering incentives? How are you doing this? Are you doing them only on the phone? Are you allowing for them to be completed offline? Do you have different translations available so that we are getting that client feedback still directly?
And I know we're almost at time, so we'll have time for one or two more questions. So I just want to mention, if you have a question that you don't have, that hasn't been answered yet, or you have one that's, you want to be posting, please type it up. If we're not able to get it to now, we're still going to go through and try to respond to a lot of these. Okay, so the other question is, as far as when you mentioned and you were talking about support C, is when a client declines, what is the option that they should be, the grantee should be selecting when they're submitting that support C?
I don't have the tool pulled up, so I don't want to give you the specific one off the top of my head. We'll get that one back in writing.
And then, so then there was another question about what date they should be basing the annual off if the NOMs had been completed previously. Should it be the baseline? Yes, then is that correct? The NOMs annual reports should be based 365 days from the baseline. And if this had been done under the NOM system, remember, you do not need, you are grandfathered in, you would be completing the A. Okay, it looks like I believe we've answered a vast majority of these questions. As I said, if you still have any questions, please post them in the chat. What I would like to go through now is just very quickly. There are some resources that I just want to make sure everybody knows about. So if you go to the SPARS page, there is a very specific section now for support A and C. You can see here in this image down there. It's part of the quick links. If you have any questions for anything to do with this, please reach out. You can reach specifically to SPARS, like we mentioned, if you have a question about any data entry issues, things that's technical things as far as the information that you're putting into there, please reach out to SPARS. It's also very helpful if you CC your GPO just to keep everyone in the loop. So if they reach out to us, a lot of the times they're going to say, do we have GPO permission? In addition to that, there is a GIPRA help desk here through us at CMHS. If the email address is cmhs.gipratool@samhsa.hhs.gov, that goes directly to our GIPRA team here, which thank you very much for Kate for being on this call. Kate helps lead that endeavor, so we will be able to respond to that. And once again, also, if you just CC your GPO on those, that's very helpful just to keep everybody in the loop, okay? And then as always, please reach out to your GPOs. They're there to help. That's part of our system. If you have a question at any time, just email them. Maybe it's a very simple question that they can answer. Maybe they can help direct those questions to the appropriate individuals that are able to provide that information. Okay, so don't forget, you can always reach out to your GPOs. We're happy to help. And as always, thank you very much for attending this webinar. If you have any questions, reach out to us. Kate, thank you very much for providing your insight and on this. We are going to hold another webinar. It's going to be the same information as this. So if you're attending this one, please don't feel like you need to attend both, but maybe there's somebody else in your team that wasn't able to attend, or there's other questions that you might have that are coming up. Please feel free to attend the other one. This is recorded. We will provide all this information. We'll be putting out an FAQ, and we're trying to respond to all these questions. But if not, I hope everybody has a wonderful rest of the week, and we'll see you next time in January for the next webinar. Thank you very much.